I now want to welcome you to the 8th Annual African American Leadership Congress. And it is with great pleasure that I announce National Public Health Week is scheduled for April 3rd through the 7th. During that period of time, I hope that you would set aside an effort to inform and to educate the public about the importance of public health. I ask that during that period, you be responsible for making a health difference in someone's life. In the past, the Health Panel has discussed a wide variety of health concerns and topics affecting the Black communities. Health issues like breast cancer, prostate cancer, AIDS, HIV, fast foods, and just about every aspect of the fast foods, even in our school system, as well as everywhere you go, you'll see a machine selling fast foods. Uninsured Californians, obesity, and diabetes. I am proud to inform you that because of the community, the California Black Chamber of Commerce, and statewide efforts, schools no longer encourage fast foods and have provided healthier choices to students. And later on in this session, one of our panelists will elaborate on that. And now to globalize the success experience through dedication and hard work, we continue to make strides to ensure healthier African Americans in California and across the United States.
Suffice it to say that African Americans in America today really are at the greater risk for many chronic diseases such as type 2 diabetes, heart disease, the sequelae of stroke, chronic arthropathies related to severe obesity such as joint disease, hip disorders, renal disorders as a result of type 2 diabetes. It goes on, and even some types of cancer. And these rates are disproportionate, significantly disproportionate to what's happening in the white Americans today. And I am going to use the term Caucasians, white, African American, interchange them. Most often I'm doing it related to the study I quote because different studies use the racial words white versus black or Caucasians versus African Americans. Everybody's lifespan has improved, but still we see a disparity in terms of how long blacks live compared to whites. So on average, blacks live 71 years compared to whites who live an average of 78 years. Still, our median incomes in California are lower than in whites. They are considerably higher than in other parts of the nation. Our median income is about $40,000, whereas these are 2000 data from the Department of Finance, whereas in whites it's about 71,000.
Can I just ask a question? I'm sorry for interrupting. Will we have access to this handout or later?
I brought some. I didn't think, I'd try not to waste paper, but there are, at the end of the lecture you can, or not lecture, talk.
Right.
I'm sorry, I lecture with students.
No, that's okay. I just was, otherwise
But yeah, no, we have
struggling to try
yeah.
to capture everything.
Yeah.
Thank you.
So why do we see these disparities in increase rates? I have a dietetics degree, and there's a lot of data and research looking at low calorie, excess calories, what is at the cause of obesity today, physical activity, environmental issues. I personally feel that there are, from looking at a lot of data, that above and beyond the lifestyle issues, we're looking at socioeconomic status, we are looking at genetic predisposition, and we are also looking at the subtle influences of class discrimination and racism. And although there are some studies related to racism and chronic health outcomes, I still think there's a need for additional research in this area. We do know that chronic stress and racism may increase the risk of preterm deliveries in African Americans, women, and we do know that the roots of obesity start in the womb. They start with prenatal care, they start with having an increased risk for low birth weight and premature deliveries, which white women have half the rate of black women in America today. The risk of adult obesity is higher, as I mentioned, in those born with low birth weight. And also there have been some studies looking at what are called the internalized racism score that can lead to increased stress. And these studies are some preliminary looks at how we can actually quantify racism with surveys and validated scoring, and I think we need to see more work there. An interesting study out of Alameda has shown, looked at long-term weight gain, and this is one of the best studies I could find, comparing blacks and whites over a 34-year period, and then also relating it to socioeconomic position, and they developed their own scoring system for that. There was a fairly large study with about over 1,000 men and 1,300 women aged 17 to 40, and what it really showed is that black women weighed more at baseline, and they actually gained more weight than white women over this 34-year period. Another study that I have put here also shows that it's harder for black women to lose weight. So not only do they tend to gain more weight and have some of the highest prevalence rates in the state, they also have more problems with keeping the weight off. Black men weighed more, but they did not gain any more significantly more weight than white men. But for black women, it really seems that race and weight gain were significantly associated with socioeconomic position. And I think this is really an important factor and really starts to prove the links between some of the issues related to obesity and socioeconomic position.
And for this particular presentation, I was very, very conscious of the group in which I am presenting with. How are you? And I wanted to modify my presentation for us to think in just a little bit of different vein, related to human justice and social justice issues. My thing is keeping it real. And what I try to do is to work in areas with the people to understand from the people's perspective as to some of the questions you have already raised. So what I've tried to do in my presentation is to give a different perspective relative to what you normally see. And so I'm saying already, I want you to think about the issue, think about the fact that we as black people and people of color are dying. And we continue to die at alarmingly high rates. We need to think about that. And it's well documented that that's taking place. But just as we have given responses related to the fact that it's not clear why that even blacks have a very disproportionate rate of death than the other ethnic groups across all stratas related to chronic disease and disease prevention. As far as a common definition, health disparities has been defined. And basically, you will see this definition, and this handout is available. We're going to email that to the chamber, and if you wish to have it, it's just too many slides and paper, and I don't want to kill any more trees. So when we look at health disparities, we want to really think about what are we talking about. We're literally talking about differences in the occurrence of an incident or a disease or a pattern of disease. The longevity of that disease, the prevalence of that disease among a population of people, the survival rate, the quality of life, these differences. And what is so critical about that is that these differences actually result in very poor outcomes. So there are disparities there. When we look at the latest data related to the U.S. deaths, overall, and when you look at age-adjusted deaths, and I just bring this to your attention, I know some of you already know that. When you're looking at the statistics, please be very careful to look at whether they tell you it's the actual death rates, or whether they tell you it's age-adjusted death rates, or how they are reporting whatever statistics they're giving. Because when you look at that, you may not be able to compare one set of data with another set of data. Then the picture will look different. When I went online to our county health department, they had the actual cause of deaths, and the common people would not know that. And the rates were very low. But normally they report in age-adjusted rates because they take age groups and they take those people in the group and then they do the calculation there, and then they may take when they get overall, they take all of those age-adjusted groups and then they would be able to get an overall age-adjusted group instead of the actual death rate. What is still prevalent is that overall deaths for blacks are 30% higher than whites. White is the majority population. 43% higher when related to stroke, 31% higher for heart disease, 23% higher for cancer, and 750% higher for HIV disease. That's real. The leading causes of death are still the leading causes of death. They've been around for quite a bit of time. And we can see both in the U.S. and California death rates. What are these major causes of death? We know them. These are the top 7. And we're all familiar with the top 7. What is common among the top 7? They're lifestyle preventable, they are extremely costly, they create disabilities, and they share similar risk factors related to, as we have discussed, obesity, limited exercise, tobacco, smoke, high-fat diet, and high blood pressure. And I want you to bear with me related to social justice and human rights issues. And what the question as to why are we suffering from these particular conditions more than other groups. There are still people who say there's no really difference, there's no ethnic and racial differences between the groups, but you need to look at your data. When we talk about having evidence, we need to question, we need to think related to the particular issues. And when you look at the data, whether there's a much discussion about it's inappropriately collected or doesn't speak well, investigate that too. But even when they don't report it correctly, you can still see that there is a difference in when blacks die and when others die. And I mean, it's a drastic difference. Death trends persist for the past 20 years. The U.S. Department of Health and Human Services knew it 20 years ago. The Heckler Report. We went to the American Public Health Association meeting, the last one they just had in November, and they reported, and the U.S. Department of Health and Human Services says, I'm sorry to report, we haven't made any difference. 20 years we've known this. Dr. Rogers tells me, Diane, it's not 20 years, it's 50 years. This stuff has been going on forever and a day. But 20 years and no difference? The Institute of Medicine just came out with their report in 2003, unequal treatment. Many of you have heard, I'm sure most of you have heard of that. Well documented. 600 studies, and they also did mock presentations with people. In other words, they had the same individuals who looked the same, who spoke the same, had the same presentation, the same condition, went to the same doctor, but one couple was black and the other couple was white. But they looked alike. When you look at them in the pictures, they literally looked alike. So they tried to have it all equal. And the black couple was treated differently and did not get the same level of care with the white couple, and they had the exact same symptoms. Everything was the same.